This is Everyday ADD Coaching. Does taking a medication make you scared? It does for a lot of people and is a barrier to getting your ADHD treated. Let's dive into the whys and wherefores of these fears. The first-line medications are some of the most effective, best-studied, most scrutinized, longest-known and safest drugs in all of medicine. These medications have been safely prescribed to children for decades. Nonetheless, no other class of medications in virtually all of medicine inspires more baseless fears, intentional disinformation and wild beliefs, as do the stimulants used to treat ADHD. Interestingly, these fears are almost entirely an American phenomenon that hardly exists elsewhere. The irony is that stimulants are the oldest class of medication in the world. They have been in use for over 100 years. They were the very first treatment for depression. In the late 1970s, a public backlash against treating ADHD with stimulant medication began after groups launched nationally organized and extraordinarily effective disinformation campaigns. This instilled a climate of fear among physicians, parents and educators and sowed anxiety and confusion among the public. Moreover, it planted in the minds of Americans the otherwise nonsensical idea that it was the treatment of ADHD that was dangerous, not the untreated medical condition itself. The side effects of medications tell clinicians which of the two classes of medication is best suited for you as an individual. Unpleasant experiences are often the result of poor clinical training and experience. Unfortunately, finding someone knowledgeable about ADD is tough, and good clinicians are often full. Fears about stimulant medication have scared caregivers away from seeking proper treatment for their children diagnosed with ADHD. The benefits of ADHD medication, based on decades of research and medical practice, used in conjunction with cognitive behavioral therapy, are profound for many people. The risks stemming from untreated ADHD are equally profound. Before we discuss the top fears about starting medications, and if this video has given you helpful information, please take a moment to like this video. It helps this video get in front of more people who can then benefit from it. What are the top fears about taking medications? Number 1. I won't be myself. It will change my personality. Stimulant medications calm and soothe the hyperarousal and loss of emotional control associated with ADHD. A neurotypical person on an ADHD stimulant, by contrast, becomes more agitated, jittery, irritable, and unable to slow down. Number 2. I'll get addicted or dependent on the medication. Many people take their medications only during the work week. It is a cost versus benefit consideration. For many people, taking them over the weekend allows them more patience or the ability to get things done. If you stop the medication, you return to the pre-treatment version of yourself. The irony is that recent studies have shown pharmacotherapy for ADHD is associated with a lower risk for substance use problems as long as medication treatment is maintained, indicating that pharmacotherapy is likely to be a crucial part of efforts to reduce substance use risk. Number 3. The medications might make me more anxious. ADHD and anxiety co-occur. The interesting aspect of this is that treating ADHD often addresses the performance-based triggers of stress. A recent child study demonstrated that most children, adolescents and adults experience a reduction in anxiety by treating their ADHD. Number 4. My child will lose weight and not grow if I treat their ADHD. This is another issue related to clinician training or the failure of good training. Severe appetite suppression is one of several side effects that indicate either the child or adult, for that matter, is on the wrong class of medication or the dosage is too high. Well-trained clinicians recognize this and make the appropriate changes. What you might face is a stigma regarding taking this type of medication, even by professionals of various sorts. You may have come from a place where you had the same stigma against drugs. I encourage you to explore the root of this negative judgment. Is it based on evidence-based knowledge? Evidence-based medicine doesn't rely on anecdotal information. It depends on science, which is constantly questioning. The best remedy for this stigma is providing good factual information. ADHD is a recognized diagnosis. There is no substitute for you becoming more knowledgeable regards the realities of ADHD. This has been Everyday ADD Coaching. Remember to give it a like and subscribe for the videos to follow. It would be helpful if you let us know in the comments what topics you would like to see discussed on this channel. Until next time, take care.